Here is something no one told you when you started your own medical practice. 50% of running a medical practice is being really good at patient care, and the other 50% is, take a guess in your head. You might be thinking luck. No, a successful medical practice, 50% wonderful clinical care. The other 50% is being a CEO and a good CEO of your own practice. This might be a new skill set you haven't had to develop yet. So we're going to dive in and uncover how you can be the best CEO you can for your own practice. Hi, I'm Dr. Annie DePasquale, the founder and CEO of Collaborating Docs. We match entrepreneurial NPs and PAs with fabulous collaborating physicians. And today is all about, as an NP or PA entrepreneur, becoming an actual CEO of your own company, which you are if you're starting your own company. So you've probably taken care of patients for many years. You're an expert. You know how to document in the EHR. You can follow guidelines and practice algorithms, and you know how to prescribe and dose it for children or adults. I mean, you know it all. You can do that part probably in your sleep. The issue now is when you open your own business, your own medical practice, you're not just a provider, you're everything. You're the scheduler, the marketer, the compliance officer, the billing team, and the CEO. That's you. So shifting to that is hard, especially if you've mostly been employed by other organizations, other people. It might seem a bit daunting, scary, but it's also a huge opportunity handed over to you. So CEOs don't ask things like, well, what do I have to do today? They're asking the question, what's the highest value thing I can do today that only I can do? There is truly a mindset shift here that it changes everything. So if you try to run the practice the same way you did when you were working in a clinic, working shifts, running from room to room to room, everything is going to be very chaotic and overwhelming. You need to make space for yourself to be a CEO. That means taking an hour off to take a walk and think. Some people like to go on bike rides or swim or, some sort of activity where you can kind of zone out and just focus on like those big, important, overarching questions. Like, what systems do I need in place at my clinic? Like, who would be the next best hire for my clinic that would really make an impact on the success of it? Where am I actually spending my time? Am I getting like a good return on that investment, or should I be using my time differently? A CEO does not have to do everything. In fact, it's very helpful and good to learn to delegate appropriately to the right person. So look at bringing on a virtual assistant or an intern or even another NP or PA student that you can precept, and they can maybe help you a little bit with taking vitals or triaging rooming patients. So, it's all about like making the most of your situation, but you need to stop thinking as employee, start thinking like an owner. You're the CEO, and these are the big decisions you have to make, but I would put the positive twist, you get to make them because now you are in charge and you do it your way. And I think there's nothing better. So as a CEO and business owner myself, I encourage you to kind of grab the bull by the horns, embrace it. It can be scary. There are lots of resources, podcasts, books, audiobooks, mentors, and help yourself grow into that CEO role. And you will definitely be rewarded for taking that role seriously. So hope this was helpful, and I will see you next time.